Objectives. After reading this module, you should be able to identify and define privacy, understand what is expected to protect privacy, define PHI, which is protected healthcare information, know how to protect PHI, and know how to report privacy violations and who to report them to. HIPAA is one of the fundamental privacy laws. Some of the privacy laws are Health Insurance Portability and Accountability Act of 1996, Privacy Act of 1974, E-Government Act of 2002, and Children's Online Privacy Protection Act. What is HIPAA? The Health Insurance and Accountability Act of 1996 was passed by Congress for the following purposes: to provide workers and their families the ability to continue their health insurance coverage when they lose or change jobs, in order to reduce health care abuse and fraud, for mandatory standards for electronic billing and healthcare information processes, and to require the confidential handling and protection of protected health information. For the sake of this module, we will focus on this purpose. Who is required to follow HIPAA guidelines? Any covered entity is required to follow HIPAA guidelines. The following are covered entities: healthcare providers, healthcare plans, and healthcare clearinghouses. Who else must follow HIPAA guidelines? Business associates of the covered entities must also follow HIPAA guidelines, and it is important that it is in the contract with the covered entity. Some of these may include insurance companies, claim payers, IT providers, and clinical contractors such as Missouri State University. Privacy. Privacy is a set of fair information practices that guarantee that personal information will be protected, that the use of personal information will be appropriate, that privacy information will be accurate, current, and appropriate. Privacy encourages trust between Equilibrium Therapy Center and its clients. Clients will be protected from their private healthcare information being released without their consent, and clients will be allowed a choice in how their information is used and/or disclosed. What is PHI? Private healthcare information is individually identifiable health information. This can include, but not be exclusive of, name, date of birth, social security number, financial records, address or email address, driver's license number, and any health information or medical record information. These can be in the form of written, oral, or electronic means. What is your responsibility? As an employee or volunteer at ETC, it is your responsibility to protect the privacy rights of our patients by following the privacy policies and procedures of ETC. How can you protect PHI? Close doors and/or draw curtains. Conduct discussions privately. Don't leave patient records or information visible or easily accessible. Don't share PHI with anyone who is not part of the patient's care or is not listed by the patient as a person allowed to obtain information, such as a family member. Share only enough information needed to care for the patient. Never take patient information with you off of the covered entity's premises. If electronic records are kept, always log off and never give anyone your password or allow them to use your login. What are the consequences of privacy violations? If you violate privacy policies and procedures, you may face employee discipline up to the point of loss of job or revoked volunteer clinical position, fines, and civil and/or criminal charges. Civil penalties. A civil penalty of $100 can be imposed for each individual failure to comply with HIPAA privacy rules. The above penalty may not exceed $25,000 per year for multiple violations of the identical privacy rule. These penalties will not be imposed should the violation be due to reasonable cause and did not involve willful neglect, and the covered entity corrects the violation within 30 days. These civil penalties are imposed by the Department of Health and Human Services, and you can be personally responsible. Penalties. Criminal penalties include an individual who knowingly obtains or discloses PHI in violation of HIPAA and will face a fine of $50,000 and up to 1 year imprisonment. An individual who knowingly obtains or discloses PHI with false pretenses faces up to $100,000 and up to 5 years imprisonment. And an individual who knowingly obtains or discloses PHI with intent to sell, transfer, or use for commercial advantage, personal gain, or malicious harm faces $250,000 and up to 10 years imprisonment, and these criminal sanctions will be enforced by the Department of Justice. How do you report a HIPAA violation? You can report the privacy violations to Kent Crumpley, who is the director in writing, to the following address, and you may also report privacy violations directly to Health and Human Services, and go to the following website to do so.